Hello everyone, I am Dr. Prashant here from India, and we are standing in one of the Central India's most state-of-the-art medical college, which proves or provides its service to the rural masses and helps the community to have the better health. And right now we are standing in the Department of Physiology, where I work as a tutor and I'm a junior resident, and the main motto of the Human Physiology Department is to make sure we impart the knowledge of this human physiology in the first year MBBS students. Also, we have various clinical aspects where we apply this physiology in patients to have better impact so that they have their clinical implications on them. So right now we'll go into the laboratories which we have, and we'll just view what we do in this particular department. Now we are standing in the hematology lab, where we train the first year MBBS students on the various hematological practices like evaluating hemoglobin, PCV, DLC and various others. Also, we give a brief about amphibian experiments as well. This is the clinical lab where students practice about various systems like respiratory, cardiorespiratory and abdomen examinations. This is an important part of their curriculum, which helps them in the final year and thus has a major impact on how to examine a patient. Right now we are standing in the clinical skill lab in the surgery workstation, where the students practice their surgical skill on mannequins and train on the surgical skills. We also have other workstations like obstetric workstation, CPR1 and CPR2 workstation, where the students train on how a delivery is conducted with the help of mannequins, and also the emergency life support of how to do CPR and resuscitate. This is the sleep study lab, where we conduct researches, and also we have machines which will improve or investigate the quality of sleep, and then we provide medications to improve their sleep. Now we are entering into the Central India's state-of-the-art sports physiology lab. This is the first sports physiology lab in the Central India provided to the rural masses. Here we gauge the cardiorespiratory fitness of each and every patient who comes to assess. And we here quantify the VO2 max, VCO2, METs, RER, heart rate variability, and also we have the grip transducer, which analyzes the hand grip strength. This is the reproductive biology lab, where the patient is asked to collect the sperm in that particular test tube, and then we collect it in the collection box, and then we take a drop of that in the test tube, and then we centrifuge it, then keep it on the microscope to analyze the motility levels, and then we take that particular sample and put it in the sperm quality analyzer, which quantifies the motility, movement as well as all the parameters in that, and based upon which we give the treatment. Now we are entering the neurophysiology lab, which is the important lab of physiology, where we conduct the nerve conduction study, BERA, VEP, and approximately we have around 150 patients of BERA VEP on a monthly basis, and around 40 to 50 patients of nerve conduction study referred from ortho, surgery, medicine to examine their peripheral nerves as well as the proximal nerves, and they provide the treatment based on our investigation studies. Thank you. These are all the various research projects that were conducted in this particular department.